GRADIA core is GC's answer to that fiber composite post and core system. It should not take you more than 5 minutes to do a post and core, and I would strongly suggest that you do not use different materials for your cementation and your core buildup. There's no reason not to use one material to do that. So how do you do this? Well, the GRADIA core kit has a number of advantages. Number one, it has a one-step self-etch bonding adhesive in the kit. It's got a dual cure bonding agent, so it's dual cure. You hit it with the light, it'll continue to cure down in the base of that canal, which is so critical. The core material is dual cure as well, and that core material we're going to use as a cement to cement our post into place. Once we hit it with the light, it's pretty well set, and we can go ahead and prep on this, and it cuts like Denton. It's radio opaque, and the fiber post is very strong when bonded. Let's take you through this step by step. All these kits come with their proprietary drills. You go ahead and create your post base inside. We then go ahead and take our brush, place our bonding adhesive inside that comes with the kit. We agitate it into the dentin. All these things like to be agitated into dentin. I'll agitate it for around 20 seconds. I'll air dry it for 5 seconds, and then I'll light cure it. Light cure it for 10 seconds. That begins the dual cure process. Once I do that, I then go ahead and inject my GRADIA core material, my dual cure composite, into the canal. I'll put a little bit. I'll hit it with the light. Once I place my post in, I'll hit it with the light. So now the post is rock solid and secure, and I've begun that dual cure reaction down into the canal. Then I'll fill the rest of this preparation up with material, light cure that, cut off the post, and we're ready to go. We're ready to prep on the tooth right away. It should not take you more than 5 minutes to do that, and you're using the same material to cement the post in as doing your buildup. A more aggressive case, a broken down tooth in the anterior. Same procedure. We placed our adhesive, we light cured, injected our resin into the canal, put the post in, hit it with the light, begin to do our buildup, continue to build it up, overbuild it, light cure all this, final buildup, light cure all this, and then prep it all the way back for our preparation. And our post becomes part of that entire preparation when it's all said and done. What about a case like this? A more difficult case. Failing endo patient comes in. We get out the old crown, realize there's a ton of decay. We take our diode laser. We'll talk about the laser in a second. I get some hemostasis. I clean up the decay. I realize it goes further and further and further, and out comes the old metal post. It didn't bond to anything. Now, what do I do in this case? Am I going to go ahead and just tell the patient to extract the tooth? Or I'm going to do a buildup here and place 2 posts. One in the mesiobuccal and one in the lingual. Now, why did I place 2 posts? When I was in dental school years ago, we did a procedure with a cast post called a removable dowel when we wanted to create extra retention. So we create a cast post with the metal post in the lingual canal, but we also had a hole in the post and core with a separate metal dowel that was angled properly into the mesiobuccal canal. So we created our post and core, our Duralay pattern with 2 posts inside. And that added extra retention. So here, on a broken down molar, I place an extra divergent post, bond it all in for extra retention. And then I go ahead and take my impression, same day, because I use my laser. We'll talk about that in a second. Create my temporary when it's all said and done. And I want to show you that impressions are very, very easy today if you have the right materials and the right tools. Just to go back, there's our temporary crown in place. That's the same day. And that post and core, even with the 2 posts and excavating all the decay, didn't take us 15 minutes to do. That's how effective and easy these post and core systems are. So GRADIA core, simple way for you to do this stuff. Realize that laboratories will tell you that over 50% of their impressions are illegible. That means they're getting just not good enough stuff from the dentist, and that's shame on us. And I understand it's hard to get a good impression sometimes, especially with multiple units. But everything boils down to poor retraction techniques, and we have to do a better job because today We have materials and technology that allow us to do a better job and make our lives easier.